You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. I'm your host, Dr. Hal. Every week, myself or my co-host, Dr. Mike, comes to you with the information that you need so that you can advocate for yourself and for your family. We are giving you the information that will allow you to fight back, and we provide information that's pertinent for healthcare that you won't hear anywhere else, but that doctors talk about in doctors' lounges all across the country. Our show is brought to you by the Docs for Patient Care Foundation, which is the only physician-led healthcare think tank in the country. Go to www.d4pcfoundation.org, Docs for Patient Care Foundation.org, and please contribute generously so that we can continue to bring you this show and do all the work that we do on a daily basis, fighting for your healthcare freedom and trying to preserve the doctor-patient relationship. We are going to talk today about a few things that I wanted to cover in the news. You know, I watching the news, I am somewhat overwhelmed, as most people I think are, by the massive amount of things that are happening that seems to be turning the world upside down, whether they are political in this country or terroristic or just things that don't seem like they are right, that what was right is wrong, what was left is right. Nothing seems to make sense anymore in this new world that we are living in. And so talking about healthcare almost seems a little bit trite, a little bit, you know, not as important. And yet when I think about this and I read about these issues in the paper every day, it makes me refocus that healthcare is the ground zero for this culture war that we're seeing being fought right now in the media, in social media, in print and visual media, in the halls of Congress, and so I think that more than ever, it's really important to stay focused on healthcare, because if we lose this battle, if we give up what is the most precious thing in our lives, which is the right to get the kind of healthcare that we want, that we need, I think that will be the beginning of the dominoes falling in terms of Americans losing their freedoms. And so as tangential or as trite as this may appear to be to some, and it was to me until I really dug down, you know, below the surface and thought more about this, I think that healthcare is so vitally important that that we need to really redouble our efforts to fight for what we have. And I think that most Americans view healthcare as a essential issue, in this election cycle coming up, and have really propelled it to the #1 issue, and the forces that are trying to change what we currently have and put in a system where there is more bureaucracy and more government control are very insidious. They're very strong, very powerful, and it is the job of all of us who understand these issues and know better to push back, to expose these people, and to inform Americans about what the forces that are trying to take over their health care have in store for them and what is at stake. And that's, I think, what the role of my show is, and what I write about, and what the Docs for Patient Care Foundation stands for. I want to cover 4 issues that have come up in the news since my last show. We'll cover some of the dominoes falling in a good way in this segment. In the next segment, I want to talk about the new CMS initiatives regarding the direct primary care and what they're trying to do in terms of modifying the current Medicare system. In the third segment, I'm going to go ahead and try to cover the testimony that our good friend and colleague, Grace Marie Turner, delivered in Congress 2 days ago. And then in the final segment, I want to cover an issue that is very near and dear to my heart, that's apolitical and actually is healthcare related and has to do with men's health, men's wellness. So let's begin today by unpacking some of the dominoes falling in a good way, as I said. I want to give a giant shout out to Florida and to my good friend Lee Gross, who has had played a big role in what is going on politically in Tallahassee, and all of those people who have fought so hard to help overturn the Certificate of Need laws. This past week, the Florida legislature, actually yesterday morning, the Florida legislature repealed the Certificate of Need laws. They became the 16th state in the country to do so. All that's left now is for Governor DeSantis to sign the bill into law. And Florida will no longer have Certificate of Need laws. Now, there are 2 bills, I think, as far as I understand it, and I'm not sure which one Governor DeSantis is going to sign. One is a complete repeal of Certificate of Need, and the other one is a limited Certificate of Need repeal, repealing it at the hospital level. And whichever bill he signs will be a major victory for those of us who have fought so hard over the last decade or longer to repeal the Certificate of Need laws, as you've heard me talk about on this show many, many times. And again, Certificate of Need laws are the pro-monopolistic laws that have allowed hospitals and other entities to restrict competition in the marketplace and protect their monopolies. So this is one of the largest factors that have resulted in the high cost of healthcare. Healthcare is expensive, and the reason why it's expensive is because there is no competition in so many markets. This repeal will open up the Florida market and allow for entities to come in and compete. And this is a good thing for patients, not a bad thing. And you'll hear the hospitals whine about their role as the site of last refuge for those who have no insurance. And this is just a giant lie, because they are not fulfilling their mandate as they were expected to do so. They are not giving the level of free care that they claim to be giving or that they were supposed to give. Kudos to the Florida legislature. Kudos to Governor DeSantis in advance of him signing one of these bills, which he's expected to do. And I look forward to seeing what is going to develop in Florida as a result. Taking the bus further north to Georgia, where I live, I wanted to highlight a couple of bills that our Governor Kemp, signed into law last week. Governor Kemp signed SB 18 into law, which I am so delighted to see happen. I was involved in SB 18, and this was the bill that was shepherded through the Georgia legislature by my good friend Kay Kirkpatrick, orthopedic surgeon and state senator from the 32nd district, who really took that on and was the chief sponsor. There were other sponsors for this, Ben Watson from Savannah, from the 1st District, family doctor. But this bill was an important bill because it protects doctors who are direct primary care doctors, and it keeps the insurance commissioner from labeling the care that they're giving to their patients as risk-bearing. So it is the first step to allow an opening up of the market for patients so that they can get direct primary care doctors. And this is a good thing for the state of Georgia, because doctors are not coming into Georgia for a number of reasons, but perhaps this will allow doctors, give them the initiative, give them the ability to go to rural Georgia and open up their practices and actually make a living. And I'm going to just finish up with what Governor Kemp also signed into law in the next segment, and we'll also talk about the CMS initiative. So stay with us.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Scherz, every Thursday morning, 8 to 9 a.m.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. I'm your host, Dr. Hal, and we are covering some news items, healthcare related. So I left off telling you about the bill that Governor Kemp signed, which protects direct primary care practices in the state of Georgia. He signed two other bills which I thought are noteworthy from a healthcare standpoint. One was a bill that required financial disclosures from nonprofit hospitals. And this is huge because the hospitals are being treated as non-for-profits. And the only thing that qualifies them for being nonprofits is the fact that they don't distribute their profits to shareholders. But these entities are some of the most profitable enterprises in most states around the country. And they pour their profits into perpetuating their giant businesses, either by hiring people and increasing their bureaucracy, giving them lavish salaries, and also by buying real estate, which they don't have to pay taxes on because they're a nonprofit. They get tax breaks for doing this, which for-profit entities don't get, and they are just increasing their footprint in marketplaces. So this will be an effort to try to restrain these giant hospitals who are getting bigger and bigger, and again, the major source of the high cost of health care, under control. The other bill, which is, I think, an important bill, is not a repeal of Certificate of Need, because that did not get off the ground in this legislative session in Georgia, but a good start to getting that to take place in the next legislative session next year is the signing of House Bill 186, which allowed for Cancer Treatment Centers of America in Georgia to be able to expand their footprint in the state of Georgia. What happened with the Certificate of Need laws in Georgia was that they were so restrictive that Cancer Treatment Centers of America were unable to see more than a certain percentage of patients. And so they only had 50 beds in Georgia, and they couldn't see they only could see a certain percentage of patients from the state of Georgia. If they were seeing more patients from Georgia, that would be in defiance of their charter here in the state of Georgia, and so they are prohibited from taking on new patients, which meant that cancer patients who wanted to go to Cancer Treatment Centers of America in Georgia could not go there. They were barred from going there, which is restraint of trade for Cancer Treatment Centers of America, but more importantly, it is limiting choices for cancer patients. And so CTCA fought for a decade to try to get this law overturned, which they succeeded in doing. And now this will open up the facility for people in the state of Georgia and allow for Cancer Treatment Centers of America to expand. Now, whether or not you think that's a good thing or not a good thing, whether you agree with their for-profit model or not, that's immaterial. That's for people to decide on their own if that's what they want to, where they choose to go, whether they choose to get their care there. For many people, the CTCA amasses all of the resources for treating certain cancers under one roof and makes it so much more convenient for patients. So for certain patients, this makes a lot of sense, while for others, it might not make sense. But again, that's up to patients. And so this is I think, a chink in the armor. It is pulling out one of those Jenga pieces from the certificate of need logjam in the state of Georgia, and opens the door to seeing full repeal in the next Georgia Congress, Georgia legislature, just as we have seen happen this year in Florida. So I'm looking forward to good things coming from Georgia, and for these two states to be leading the way in getting full repeal of certificate of need throughout the country. So that brings me to Medicare and CMS and what they have done. This past week, CMS launched their value-based primary care initiative, and it has met with mixed reviews. Our president of the Docs for Patient Care Foundation and one of the founders of the direct primary care movement, Lee Gross, has been in Washington more times than I can count in the last year and a half, and he has been in the middle of all the discussions with the people at CMS and HHS and at think tanks in Washington, trying to wave the banner for direct primary care. This is such a political hot potato and so difficult to navigate that I'm not sure that there's a satisfactory answer to this problem. But I'm not sure that what happened with the launch of this CMS-based initiative is going to be the solution for the healthcare issues that are confronting so many Americans in this country, specifically the high cost of healthcare. Again, the high cost of healthcare has to do with several factors. It has to do with the hospitals and no competition, and we just covered that. It has to do with the high cost of drug care. Those drugs are just it's a crime what is happening with the high cost of drugs, and the high cost of insurance, and the insurance companies just gouging patients and giving them very little value for the high premiums that they are charging patients. The last part of the high cost of care has to do with bureaucracy, whether that is from the government or from insurance companies. And so if in a perfect world, if we were able to start over and create a brand new healthcare system, it would be getting rid of all of those special interests, and it would be allowing patients to be in charge of their healthcare and their healthcare dollars. Now, entitlement programs muck up the works considerably because the government is paying the bill. And by the government, I mean you and I. Now, unfortunately, the Medicare program is on a fast track to bankruptcy. Whether whichever projections you choose to adopt, whether it's the insolvency by 2026 or 2030, it really is immaterial. We know that this is a system that on its current trajectory cannot sustain itself. So there are efforts to reform it. How this is reformed is the answer. And who is coming up with these reform plans very much will determine what kind of benefits Medicare recipients get and what kind of care they receive and who is delivering this care. So what CMS has done is they've launched a value-based initiative. So it's going to be incentivizing providers to reduce hospitalizations and to cut costs by rewarding them through performance-based payments. That means that based on how well the doctors do in keeping patients healthy and keeping them out of the hospital, they will get paid accordingly. So there is a downside risk if they are not doing the job that they have signed on to do. They can actually lose money. They can get paid less than they currently get for seeing Medicare patients, as much as 10% decrease in what they're making. But there's an upside potential of 50%, which would be based on how much those doctors saved the Medicare program by keeping certain patients out of hospitals. Now that becomes really bulky, really cumbersome, figuring out how do you calculate that. So let me just try to unpack that for you. Let's just suppose that you are a doctor who is taking care of diabetics. And in your practice, you've got 100 Medicare patients who have diabetes. And the government statistics show that out of every 100 diabetics, 5% of them are going to wind up with inpatient hospital care during that calendar year. If your population of patients, instead of having a 5% hospitalization rate, has a 3% hospitalization rate, well, you've saved the government the hospitalization on 2 patients. And so the government will reward you because you've kept them out of the hospital. So they'll pay you more money. This is a slippery slope, and I want to try to unpack that for you and explain that in the next segment. So you've got to stay with us.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Obamacare is failing. We all know that, but you need to know why and what you can do to get us back on the right track. Visit us at ObamacareWatch.org. This is Grace Marie Turner of the Galen Institute. Join us at ObamacareWatch.org.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com. The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docs4patientcarefoundation.org. That's www.docs4patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Back in the Doctor's Lounge, thank you for being with us today. We are unpacking some news items that have come up in the last couple of weeks. We left off talking about the new CMS plan to try to inject some risk into doctors taking care of patients. And really what is happening is that by doing this, by injecting this risk, you're essentially asking providers to pay for consequences that they may not have any control over, and you are expecting them to be able to get patients to comply with recommendations when in fact doctors really have very little control over whether or not patients are going to take their medication, whether they're going to come back for follow-ups. And so the unintended consequences of tying payment to outcomes is that doctors simply won't take sicker patients. They'll just take healthier patients. Now, the people who came up with this plan think that they're going to be able to prevent the cherry picking from going on by making them take groups of patients. But at the end of the day, that is not easily done. And I think that the unintended consequences are unforeseeable. And this is not a system that we have, as advocates for direct primary care, have endorsed nor advocated for. This program and these ideas are generated by bureaucrats who think that they know how to run healthcare systems better than people who are taking care of patients on a daily basis. And it's interesting that there are two pathways for primary care in this model, three for accountable care organizations. So these models are really not intended to protect patients. They're intended to continue to perpetuate the healthcare, quote, system, which is really not a system at all, but it is still an effort to maintain control over healthcare at a macro level. And the accountable care organizations, which was a creation under Obamacare, and one which the government spent millions, tens of millions on to create, something that they just cannot let die. And the accountable care organizations, for the most part, are large hospitals and insurance companies. And so this plan panders to them and gives them an opportunity to manage large populations in the Medicare Advantage plan, managed Medicaid, and other group health care that the accountable care organizations are currently managing. And so instead of letting this idea die on the vine, which it should, this should die a quick death, these accountable care organizations, and give health care back to the patients instead of trying to manage it. Because every time that you try to do that, the choices diminish, the waits are longer, the quality diminishes instead of improves. And what this direct contracting is, it's another throwback to the worn out idea that failed, which is capitation. Remember the capitated HMOs? It did not work because people were unhappy. And this initiative is a recreation of the capitated HMOs. And the people who've created this plan believe that there's going to be interest here because they believe that this plan simplifies the lives of doctors, but there's been a tremendous amount of pushback by physician groups, by the Direct Primary Care Coalition, by the American Association of Physicians and Surgeons, and this, has been. It appears that this is just another way of repackaging third-party ACO-controlled care or capitation, and it is a far cry from the direct primary care models that we have been advocating for over the past 10 years. And so hopefully there will still be efforts to modify this plan and give more autonomy to patients, try to unpack insurance from this and not allow insurance to control the care, which is what this is, rather than patients being able to decide where their healthcare dollars go. And that would mean going to doctors directly and deciding where they're going to get their care. And the people who came up with this plan believe that the direct primary care movement is a throwback to the Norman Rockwell kind of view of physicians taking care of patients as if that was a bad thing. It's not a bad thing. It's a very good thing. But these bureaucrats, these institutionalists, if you will, have a very different view about what healthcare should look like. And it is not patient-based, patient-centered. It is population-based. And there's a very big difference. I'm going to say that again. Healthcare should not be looked at in the macro level as population-based. It is individual, it's personalized, it's between a patient and their doctor. And that's not what people in government view healthcare to be. It is not what insurance companies, what hospitals, or any big organization views healthcare to be. And what we need is not turning the clock back and taking steps backwards. What we really need to do is focus on what healthcare is and should be, rather than what institutionalists want it to become. We don't want to put a square peg in a round hole, and that's what the whole direct primary care movement is all about. It's about giving patients the control over their health care once again, like they once had. And this is doable if they control the dollars. If somebody else controls the dollars, it's a different story. Which brings us to the third issue that I wanted to talk about, which is the ultimate control over healthcare dollars, which is the Democrat plan to nationalize healthcare, the Medicare for All plan. And I have spent weeks talking about this, having guests on the show, trying to examine and re-examine and litigate and unpack this issue. I can't say this enough, and this is going to be the number one issue this election cycle. The people who are pushing Medicare for all. It is not Medicare for all. It is the end of Medicare, the end of Medicare. It is Medicare for none. It is not capitation. It is socialized health care, and it is wrong for America. And every day you can pick up the newspaper and read about this. In today's Wall Street Journal, May 2nd, there's an editorial that sounds like I could have written this editorial. This is exactly what I have been talking about on this show for the past 3 months about Medicare for all. and it talks about Medicare for all is the end of Medicare. Well, this past week, actually 3 days ago, our good friend Grace Marie Turner testified before the House of Representatives Rules Committee to discuss H.R. 1384, the Medicare for All Act of 2019. And she very clearly explained to the members of this committee how Medicare for All was a dangerous concept, and that the Congresswomen, Pramila Jayapal and Debbie Dingell, who sponsored this along with 107 co-sponsors, are just wrong about this on every level. And she really did a great job of unpacking this, and I really commend her for doing this and recommend people go to the website. It's on the Galen Institute website, and read her testimony, which is really very, very powerful. She talks about how the problem is cost. She focuses on insurance costs. I like to focus on global healthcare costs, as you heard me say earlier: hospitals, pharmacy, insurance, and government. And what she actually elaborated on quite well is that this model, that was H.R. 1384, abolishes all health care. It sunsets Medicare. It rolls everything into a single plan. It outlaws private health insurance. It criminalizes doctors who decide to contract with a patient directly. It will require that there are protocols for certain treatments for certain diseases, and it will establish boards and panels so that they can decide who gets what kind of treatment when. And it is a program that's the worst of all possible socialized healthcare plans in the world, globally. And it would reduce the reimbursement to physicians initially by 30% and then more. And it would result in a giant physician shortage and make the existing problem infinitely worse. And she went in to say that there is a better way of doing this, and she went through some of those options, which I'll just touch on in our last segment, so stay with us.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docs4patientcarefoundation.org. That's www.docs4patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Thanks for being with us today. This is the last segment of the Doctor's Lounge. I'm your host, Dr. Hal. We're unpacking some news items, healthcare related, that have come up in the last couple of weeks. I was talking about the testimony in Congress from Grace Marie Turner, who I will have on the show coming up in the not too distant future to do this herself. But what But what she really tried to emphasize to the committee was that employer-sponsored health insurance is the pillar of our healthcare system in the U.S., and this would disappear under the Medicare for All plan. And the reason why this is the central pillar is because physicians are receiving higher reimbursements from patients who have these kinds of plans, and this is helping to subsidize those patients who are covered by government plans, where the payments are less, and the doctors are willing to accept those patients because these lower payments are offset by better patients who have better payment plans, better insurance that pays higher rates. Frank Luntz did a survey, she said, of Americans with health care, and 71% of Americans with employer-based health care are actually happy with their coverage. The big problem with employer-based coverage is that if you leave a job, you don't get to keep your insurance. So that is something that's easily changed. The other is that if you work for a business and you're covered, but your family isn't, and you have and you're given the ability to pick them up, you very often can't pay for it. And so there are health reimbursement arrangements or health savings accounts where you should be able to use that money to cover your dependents. And that's something that the Trump administration has been working towards, and something that we should be embracing. She pointed out that there are better options than the socialized healthcare plan of the Democrats, which are promoting the association health plans, allowing for states to have the innovation waivers and promote those, and mentioned other options that the group that she heads, the Health Policy Consensus Group, have come up with to give patients opportunities to see their healthcare plans or their healthcare costs reduced. High-risk pools, things that have been discussed at the state level by many people over and over again. And so the problem is that for the 10 or 15% of the population that all of these issues would not be helpful for, it does not make any sense to blow up the healthcare system. Yet once again, for the 85 to 90% of people who are satisfied, or who are marginally satisfied, but who could see improvement with some tweaks. And that's what really needs to happen, again, by considering the high cost of healthcare in the 4 buckets that I've mentioned, and not looking at this just as a singular problem with insurance or with pharmacy, but looking at high costs across the spectrum like we've discussed. I rushed through the Grace Marie Turner testimony because I wanted to cover something non-political that I really was quite interested in, and I hope that you will be as well. It was a front page article that appeared in the Wall Street Journal on 2 days ago that was entitled, "Men, the Doctor Would Like to See You Now." And what was so interesting to me was that this article and a good portion of this healthcare segment of the Wall Street Journal was devoted to men's health, men's wellness. As a urologist, this is something that we are confronting on a daily basis. The fact that men are not likely to get the kind of care that they should get, and that around the country, efforts are being initiated to make urologists the gatekeeper, if you will, or the primary care doctor for men, because of the reluctance of men to get to see their doctors. Most men, the majority of men, after they stop seeing the pediatrician at age 18, don't go back to see a doctor again until they're in their 50s or their 60s. There are lots of reasons why that happens. There's the machismo kind of feeling about men that they are invincible and that they shouldn't need to go see a doctor. It's a sign of weakness. They don't get sick. They don't have time to take off from work. I mean, there's a number of issues. And in fact, multiple surveys have shown that in married couples, it's the woman who makes 90% of the healthcare decisions for the family, including the husband. And so around the country, what is now an increasing trend, systems are embracing the fact that urologists are an opportunity to improve healthcare for men, because men are seeking help for two main reasons. They either are having problems going to the bathroom, they have problems with their prostate, or they are having problems in the bedroom. They can't get erections, they can't maintain erections, they're having some kind of issue. And in many cases, we know that that problem is caused by a medical issue: diabetes, hypertension, other neurologic issues. And so this is an opportunity for men to get better health by utilizing access into the healthcare system through the urologist and allowing them to be the centerpiece, the entry point into the healthcare system where they've checked out years and years ago. So let me share some statistics with you that I just found so incredibly fascinating from this article. So risky behavior. Men are way more apt to engage in some of the risky behaviors that we see in healthcare. Of the people who drink at least 4 drinks in a day in the past year. So let me say that again. Age 18 and over, people who've had 5 or more drinks in a day at least once in the past year, 30% of men have claimed to engage in that behavior, whereas of women, 20%. 18-year-olds or over who currently smoke cigarettes, men 16%, women 12%. People under 65 without health insurance, men 12%, women 9.5%. So these are risky behaviors that men are more likely to engage in than women. Of the major health problems, high blood pressure, diabetes, arthritis, cancer, heart disease, men statistically are at greater risk of having every one of those than women. And so here's some startling statistics. Only 60% of men go to the doctor for a routine checkup. 53% of men say their health just isn't something they like to talk about. 35% of men say they are comfortable talking with their friends about injuries from sports or other guy activities, but not anything else health related. And only 12% of men say that they would turn to a doctor first for health issues versus 48% who would turn to their spouse or partner. So by making it easier to talk to doctors because of men coming in for problems that really do bother them, there's an opportunity to actually improve health, improve outcomes for these major diseases that we're seeing, and to actually lower the global healthcare costs, things that we've talked about on each of the segments today. And so rather than figuring out how we're going to cut reimbursement or how we're going to be limiting access to care or rationing care or doing other things that limit healthcare choices, it makes much more sense to broaden our reach, to think outside the box, how we're going to be able to make men healthier. And to me, this segment in the Wall Street Journal hit the nail on the head, that the way to do this is to give an opportunity to men to talk about the problems that they're not necessarily going to the doctor about. So this is also going to be the subject of another show where I'm going to get one or two of my partners to come in and talk about men's health and how we can make a giant impact on the cost of healthcare by, as urologists, being able to give men access to the kind of care that they're not receiving and open up a whole new avenue for them and improve health. So I appreciate you letting me inform you about healthcare issues in the news today, and I hope that you got a lot out of this, and I look forward to having you come back and join me in 4 weeks. I won't be here in 2 weeks. I will be out of the country. We'll be playing a best of Hal show for you in the Doctor's Lounge. Thanks for being with us.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Scherz, every Thursday morning, 8 to 9 a.m.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you.